Thank you so much, first of all, for spending your time here this morning. We know everything you've been through those last few years has been a lot, and I know it even stems from childhood, from when you were 6 years old, and this whole journey you've taken. But my question for you is, having gone through this process and suffered your whole life, and where you're at today, can you just tell me kind of more, not necessarily from your childhood, but from in the last few years, how this has affected you?
Yes.
How the treatment has affected you, and would you do it again? Would you recommend it to other patients?
Yes. Actually, it has been, like you said, a long journey. I did notice a huge change after I've done my surgery, mostly on my airway. And as a bonus, cosmetic.
Yes.
My main goal was also to be healthy, and I do feel way much healthier. I've been tired my whole life, and I thought that it was for different reasons,
Yes.
Motherhood, studying, and everything. But after the surgery, it's like I am fresh every day, and I'm energetic, and so that to me is so worth it. And again, I feel also my gums are healthier. Like I don't feel that weird sensation. I feel as well that I look prettier. I have self-confidence as well. I like my profile, and even though that, again, it was not my main thing, it is really important as well.
Yes. And then one other thing, because for the viewing audience, not only did you do orthognathic surgery, which is a very involved procedure, and it takes a very skilled surgeon to do it in the method that Dr. Alfie does, but you went through surgically facilitated therapy with full mouth grafting.
Yes.
So can you speak a little specifically to those two different procedures and how your experience was?
Yes. So in order to get ready for the surgery, we have to get my gums again in good shape. For different reasons that you can explain better, my gums were with a lot of recession. We had to get my bite and my teeth in a place where Dr. Alfie could perform his surgery. So we have done the gum surgery. It was my first surgery, and it healed very quickly, even though it was for me a hard one. But it's amazing how it heals quickly, and it felt already like coverage. It felt like there's you feel like some sensitivity on your roots. So that already, and even cosmetically, I felt, oh, I like this teeth again. So once we had gone through my orthodontia, we have better quality of gums to hold the teeth.
And bone, right?
The bone as well, that's right.
Yeah.
So I would say that process feel faster compared with the whole thing.
Yeah.
And it was very worth it. Again, it's to me, I would do it again. It's worth it. You need it. The team job was super important. Every one of you were very well communicated. You had a plan for me. It was not me like had to research for different people and see what's the step A, B, C. I felt like I was in a really good team, supported by all of you. The orthognathic surgery helped me a lot with the breathing, but then I could get it better as well if we work on the alignment of my body. I felt right away, for example, that I have some knee pain and some other stuff that were all related, some hips as well. So they have done a really long evaluation to understand how was my body working, and also with my eye. I have my right eye that doesn't see that well on my left one. So working with them and putting all these pieces together is going to kind of lead me to have a better as well, overall health, but also breathing. So
Yes, yeah.
that's what I like about this treatment, that it makes sense. You're not just looking at your mouth, it's everything connected, and it starts with
Yes.
your tongue.
Everything's connected.
Yes,
Yeah.
everything is connected, and it's like, you just kind of just one thing, you have to work with the whole body.
Awesome.
So
Well, thank you so much.
you're welcome.
Very